I had this question recently about, are larger varicose veins more painful to treat, and how long or what is expected for the recovery? Now, the first thing I would say is for most patients who are having treatment of their larger varicose veins, most of it is done under local anaesthetic. That means that you do not feel much during the procedure and you're completely awake. With that being said, you will still feel a bit of stinging here and sometimes a little bit of burning and a bit of pressure, but otherwise it is really well tolerated by most patients, even those that are needle phobic or very nervous. Now, the most important thing to think about in terms of recovery really depends on how large these varicose veins were when you started, whether you had previous surgery on them, and whether they've come back with recurrence. These are important factors to sort of distinguish how long your recovery period is going to be. For most patients that have had their varicose veins for 30 or 50 years, the recovery can be a little bit longer, especially if you have these large veins bulging out of your legs. And when I talk about recovery being longer, we're talking about anywhere between 2 to 3 months before you actually feel like your legs have completely settled. Now, with that being said, most of the time you'll be back to doing your regular activities and work, but it's just that little bit of uncomfortable feelings that you may have or may perceive during that 2 to 3 months. Now, if you've had the varicose veins for about 5 to 10 years, you might feel that it completely feels back to normal within the first month or even less than that, and it really depends on each individual. Now, the most important thing I would say is that in terms of the pain and the recovery, most patients do really well in terms of the tolerance, especially during the procedure or intra-procedural, and after during the recovery. Again, it depends on the length of time you've had the veins and how large or complex they are.